This is an information video to show the patient journey through the endoscopy unit at the Royal Bolton Hospital. The endoscopy unit is on the first floor in E block, which is in the blue zone of the hospital. If you need any help getting around the hospital, there is a reception in the main entrance where you'll be able to ask for help. There are also volunteers in yellow t-shirts who can guide you. One of our patients will now talk you through what will happen during your appointment.
When you arrive at the endoscopy unit, please book in at the reception desk. After confirming some details like your name and date of birth, you will be asked to take a seat in the waiting area. Friends or relatives can wait with you until you are taken onto the unit. There is a coffee shop and a restaurant downstairs on the ground floor. You can expect to be with us for 2 to 3 hours, and we will ring your friend or relative when you are ready to go home. We have 4 procedure rooms on the unit, each with their own list of patients, so it could seem that others are being seen more quickly than you. One of the team will take you to a private room to prepare you for your procedure. If you need your relative or friend to be with you at this point, please let us know. Please bring a list of medication you are taking. Please leave your valuables at home. A name band will be placed on your wrist, and you will be asked some questions about your medical history. We will recap what will happen during the procedure and explain why you are having it done. Your blood pressure and pulse and temperature will be taken, and you'll be asked to sign a consent form. A small plastic cannula will then be inserted into your hand or arm to allow us to give any medication required during the procedure. You will then be shown to a changing room in the male or female area. Here you will be asked to change into a gown and some privacy shorts, and given a basket to keep your belongings in. Please let us know if you need any help to change or to move around the unit. You will be asked to take a seat until it's time for your procedure. When it is time, a member of the endoscopy team will take you into the procedure room. They will stay with you and support you throughout the procedure. We will help you onto a trolley, and the team will introduce themselves. Here at Bolton we have a mixture of male and female staff who will be caring for you. If you have any concerns about this, please contact the unit ahead of your appointment. If you are here as a part of the bowel cancer screening program, there will be a specialist nurse in the room in a purple uniform. Some final checks will then take place before the procedure can begin. You will be helped into the correct position for your procedure. In most cases, this will be on your left side. We will cover you with a blanket and place a monitor on your finger to measure your pulse and oxygen levels. If needed, you will also be given some oxygen, usually through a thin tube placed at the end of your nose.
During a colonoscopy, a long, thin, flexible tube with a camera on is passed through the back passage all the way around the large bowel. This allows us to see the lining of the bowel wall and take samples and photographs if needed. You can expect a colonoscopy to last about 45 minutes, and you can watch it on the screen if you wish, but please remember that the image is very magnified. Harmless carbon dioxide is used to open up the bowel so that we can see the lining more clearly. This may cause some bloating or cramp-like feelings. Most people find colonoscopy uncomfortable at times, but please tell us if you find it painful so that we can help. We may be able to give you a sedative and some painkiller to make you more comfortable during the test. If so, you will need someone to take you home and to stay with you for 12 hours. Once the procedure is finished, a member of the team will briefly advise what happens next. As an alternative to sedation, we can usually offer some gas and air during the procedure to help with any discomfort you may experience. Once the procedure is finished, a member of the team will briefly advise what happens next.
You will then be taken on the trolley to the recovery area where you will be monitored. A member of the recovery team will monitor your blood pressure and your pulse as needed. Now that the procedure is finished, any discomfort should begin to settle. If it doesn't, or you are worried about how you are feeling, please tell any member of the recovery team. Your plastic cannula can then be removed. Here at Bolton, we have separate male and female recovery areas with toilets and changing facilities. When ready, a member of the team will contact the person who is collecting you, if needed. You can then change back into your own clothes and make your way to the refreshment area. Again, if you need any help with this, please ask a member of the team. One of the team will collect you from here and take you to a private room to discuss initial findings from the procedure. If you would like a friend or relative to be with you during this discussion, please tell one of the team. You will be provided with an Aftercare booklet, a copy of the procedure report and any other relevant leaflets. Following this appointment, you will be contacted about your results by the team responsible for your care. If you've got a sedative, the person collecting you will need to come to the unit to meet you. When you leave, the lift and the stairs are to the right.
If your appointment was arranged by the bowel cancer screening programme, one of our specialist nurses will ring you on the next working day to check how you are and to talk about what happens next. Once you are home, it is important that you rest. If you begin to feel unwell in any way, then please follow the advice in your Aftercare booklet. If you have any questions or concerns about your appointment or anything you have seen on this video today, then please contact one of the numbers on the screen.